Hey, Dr. H here, another episode of Physio on the Go. Going for a little kind of rest day run hike. Nice trail near our house with my daughter Tanya. And hopefully we'll loosen up the legs a little bit. Went for a long run yesterday. Getting old, so I have to also take some recovery days. So what we're going to do here is to continue our discussion on the right side and left sides of the heart and what happens when either can't pump the blood or when they're in heart failure. Okay, so we can put this on here so we can give you a little view of the trail while we're cruising along here. Listen to the birds. So right side versus left side, you can check out our other episode talking about that. So make sure you watch that to understand the systemic circuit and the pulmonary circuit in the cardiovascular system. Okay, so tiny review. The systemic circuit starts in the left ventricle through the body to the right atrium. Pulmonary circuit, right ventricle through the body to the left atrium. Okay, so both of these are happening, right? They are functioning in series, one after the other. That's important to understand because the blood from the left side that gets pumped then has to be pumped by the right side, and the blood from the right side that gets pumped then has to be pumped by the left side. Okay, because we're continuously going through both of these circuits. So what happens if one of the circuits is struggling? Let's start with the systemic circuit, the left ventricle. Yeah, what if the left ventricle is struggling to pump the blood that's coming to it from the right ventricle? Okay, or we have left-sided heart failure. Okay, what does it mean to have heart failure? Briefly, it basically means you can't pump enough blood out of this chamber. Okay, or you can really only do it when it is super stretched out. Okay, and we'll talk about the Frank Starling law of the heart some other point. Okay, but when the left ventricle is struggling to pump blood out to the body, what difference does it make? Well, there's two problems. There's a forward failure problem. What does that mean? It's not pumping enough blood to the body, right? So that can obviously affect a lot of organs out there that need the blood from the left ventricle to give them oxygen and pick up waste like CO2. Okay, so what is a problem if the left side fails? Forward wise, okay, you're not delivering the blood adequately to your organs, and that causes a whole host of problems because you need blood with oxygen in your organs. All right, so that's a forward failure issue. Now there's also what we call a backward failure issue, and that means the left ventricle is receiving blood from the left atrium, but that's getting blood from the lungs. Yes, okay. So the blood that feeds eventually the left ventricle came from the lungs. Now, if that blood is being pumped from the right side through the lungs, and the left ventricle can't pump that out forwards, what tends to happen is that fluid builds back up into the lungs, okay? So what happens when the left side fails? Fluid backs up, not in the body. We can't pump the fluid to the body well. In the lungs, we have a backward failure into the lungs. So people complain of shortness of breath when the left side of the heart fails. Why? Because fluid that should be being pumped from the left ventricle out to the body is not. So it's backing up into the lungs. Okay? So with left-sided heart failure, what happens? We have fluid not being pumped forward to the body, forward failure, not enough stuff to your organs, and then that fluid is then backing up into the lungs, backward failure. Okay, and what are the signs and symptoms? Okay, so shortness of breath, especially when somebody lies down. Okay, because when you lie down, more blood returns from the body, and that eventually goes from the right side to the left, and you struggling to pump it, so it goes back to the lungs. Okay, so someone experiences what's called paroxysmal nocturnal dyspnea. Okay, paroxysmal means it is onset, it's not there all the time. Of course, nocturnal is at night, and dyspnea is shortness of breath, kind of like I have now, trying to talk and walk up this hill. Okay, so anyway, paroxysmal nocturnal, what happens? People lie down at night and fluid builds up in their lungs, short of breath, they have to sit up, it gets better, they lay back down, okay, sit up, it gets better. Okay, this is a sign of left-sided systemic circulation heart failure. All right, so that's the left side. Okay, now the right side, what's it doing? It's receiving the blood from the body and pumping it forward through the lungs. Okay, well, just like we can have a backward failure on the left side, backing into the lungs, the right side, if we can't pump the blood to the lungs that's coming in from the body, it backs up in the body. Okay, and so the backward failure from the right side is fluid building up back into the systemic circulation out in the body. And usually we get what's called dependent edema. Edema is just the accumulation of fluid, and dependent means the lowest parts. Yes? So if you're standing up, feet and ankles are swelling and all these signs. Okay? So what do we get when we have right-sided heart failure? The backward failure goes back into the systemic circulation, so we get a peripheral edema out in the periphery, and a lot of times it is a dependent edema. The low extremities is where things are swelling up like the ankles. Okay, so two kinds of heart failure in terms of sides of the heart are left-sided heart failure and right-sided heart failure, and we should understand what's going to happen when the left side can't pump the blood it's getting, or the right side can't pump the blood it's getting. Okay, I hope you found that helpful. Take care, and God bless.
Thanks for watching Physiology Fundamentals with Dr. H. Please like and subscribe, and don't forget to get outside and go for a run.